Keep watching to see additional important safety information at the end of this video.
I'm Margie and this is Debbie.
Hi.
And we've been friends for about 15 years.
I like to say that Margie loves to cook and I love to eat.
I've been a personal chef for years, but lately my passion has been fermenting hot sauces.
I've been in retail management for years. I love working in fashion.
So we're both pretty busy, but we definitely find time to take our doggies out for a run.
So we started looking into Botox Cosmetic a few months ago.
Debbie and Margie heard about the Look of 3, a Botox cosmetic treatment of 3 areas, 64 units, at least 3 times a year. If your specialist thinks it's right for you, you could get the look you're looking for. Only Botox Cosmetic is FDA approved to temporarily improve the look of 3 areas together: moderate to severe frown lines, crow's feet lines, and forehead lines in adults.
We like that Botox Cosmetic is approved by the FDA for simultaneous treatment in all 3 areas. There's peace of mind knowing that it's got all this science and FDA approvals behind it.
I'm so happy our doctor decided Botox Cosmetic was appropriate for us because it's been meticulously studied.
Not to mention, it's the only product of its kind.
And then he told us about the Botox Cosmetic plan. It made a lot of sense. It has 3 different parts. First, he assesses the 3 areas where you may need Botox Cosmetic: frown lines, crow's feet lines, and forehead lines.
Everyone's different, and you have to be sure you're not getting fixated on any one area where your doctor might recommend that you need all 3 areas.
And being consistent about our appointments helps make sure we get the results we want.
It feels really good to have a game plan.
Before we start, I need to let you know that there are risks associated with this product.
Okay.
Its effects may spread hours to weeks after the injections, which can cause serious symptoms.
So we got our first Botox Cosmetic treatments.
We started to see results within 48 hours in our frown lines, but our doctor explained we would see full results in 30 days.
I'm super excited to see the Look of 3 at 30 days.
It's been 30 days since getting our Botox Cosmetic treatments.
I was pleasantly surprised how quick the treatment was that day.
And now we're looking in the mirror. It's us with fewer visible lines. Yeah, this was a good choice.
Approved uses. Botox Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of moderate to severe forehead lines, crow's feet lines, and frown lines between the eyebrows in adults. Important safety information. Botox Cosmetic may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, and trouble swallowing. Botox Cosmetic dosing units are not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when Botox Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, and/or forehead lines. Botox Cosmetic may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox Cosmetic. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not receive Botox Cosmetic if you are allergic to any of the ingredients in Botox Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myobloc, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A. Have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, have trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox Cosmetic can harm your unborn baby, are breastfeeding or plan to. It is not known if Botox Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Using Botox Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox Cosmetic in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin, such as Myobloc, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinners. Other side effects of Botox Cosmetic include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids and eyebrows, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-678-1605. Please see Botox Cosmetic full product information, including boxed warning and medication guide.